Hi, I'm Eric Steinberger, and I'm going to be talking about skin cancer. So, skin cancer is the most common type of cancer in the United States. There are two types. There's melanoma, which forms in the cells that make up the pigment of your skin, and there are non-melanoma skin cancers. That's the other group. Pretty much every other type of skin cancer that doesn't occur in your melanocytes. Luckily, these non-melanoma skin cancer is much less aggressive and very easily treated. So that's a positive thing about it. Skin cancer is caused by UV radiation, pretty much from the sun or tanning beds. Some sun lamps in greenhouses emit UV radiation as well, but it's most likely from the sun. That's the main cause. So what happens is that UV radiation hits a cell on your skin, and it damages the regulatory genes in your skin, the things that are responsible for fixing the cell or undergoing cell apoptosis, which is cell suicide, killing the cell when the cell is damaged. But when the UV radiation penetrates these regulatory genes, now the cell cannot regulate itself. It cannot keep itself in check. It cannot fix itself or kill itself if worse comes to worse. So what happens is that these damaged cells or mutated cells are now rapidly replicating themselves because there's nothing to regulate it, and it forms a tumor on the skin, and it can spread to other parts of the body if it's left untreated. It'll just keep on replicating itself. Skin cancer is very, very common, like I said before. 1 in 5 people in the United States have skin cancer or will get skin cancer at some point in their life. In 2012, 2 million cases of non-melanoma skin cancer occurred. 68,000 cases of melanoma occurred, and 48,000 cases of early stages of melanoma occurred. So that's a lot of people every year, and the numbers just keep working their way up as well. Symptoms are, it's pretty much a mole, any kind of mole on your skin. You have to look at size, color, and shape of the mole to determine if it's potentially malignant. And for size, it should be, in most cases, it's larger than 1 centimeter. In certain cases, it's smaller, but usually if it's under 1 centimeter, usually you're okay. The coloring is uneven across. It's not just one shade. There's like different shades of coloring within one mole. That's a big sign of melanoma. The shape is jagged. It's not like a perfect circle or an oval, but it's a very jagged looking shape. For non-melanoma signs and symptoms, it could be pretty much just any kind of mole. Any kind of mole can be cancerous, especially red, shiny, smooth moles. Those are usually not melanoma skin cancer symptoms. So what they use to determine if you have skin cancer or not is something called a biopsy, where they take a part or a piece of the mole, or sometimes they just remove the whole thing, and they send it to a lab, and the lab analyzes the mole and determines whether or not it is cancerous. If it is cancerous, early stages are treated with just removing the tumor, just physically removing the tumor and any surrounding tissue or lymph nodes. It's just getting rid of all that stuff. Later stages usually use chemotherapy lotions or injections right on the spot. They'll rub the lotion in right on the tumors, or they'll inject it with chemotherapy. For melanoma, a big type of treatment is called biological therapy. These are drug injections that actually help the immune system destroy the cancer cells. Prognosis, it's 2 to 4 times a year after the skin cancer is cleared that you'll get checked, and it's just a physical examination, scans, blood tests, stuff like that. And to conclude it all, I mean, it's the most common type of cancer. It could be chronic exposure or just one intense exposure, and hopefully a decrease will occur.